side. Oh, before I do that, I'm going to decap BTLS the arm. In case some of my additional resources get here, I can maybe get somebody to get a set of vital signs. So I'm going to check the first part of the arm for bones for stability, checking for any gross blood, decap BTLS, the elbow, the lower arm, pin it down, check the radial pulse. Sir, can you feel what finger I'm touching? Now, if I get my additional resources arrive, I can get a set of vital signs out of that arm because I cleared it. Moving over to this leg, checking for stability of the bone, checking all around for gross bleeding, looking at my gloves, nothing there, checking the stability of the knee, gross blood, decap BTLS, nothing there, checking the bottom of the leg for gross blood, decap BTLS, nothing there, pin down the ankle, check the salus postibulus pulse, dorsalis pedis. Sir, what toe am I touching? What toe am I touching? He's unconscious, so he's not talking to me. I'm going to move up, and I'm going to do the arm, checking the upper arm for bone stability, checking for gross blood, decap BTLS. I'm checking the lower arm for stability, gross blood, decap BTLS. Pinning down the wrist, checking for the radial pulse, making sure it's done. Okay, can I have some additional resources to do me a log roll? Log roll happens, okay? Who's in charge of the log roll?
Person at the head.
Person holding C-spine. I'm checking the complete back, checking for decap BTLS. I'm moving down to this area, the anal area down here. I'm checking for buff. Now, if your random basic skill is backboard, they'll let you know before you start. Because that way you can just slide it back on the backboard. You don't have to do 2 log rolls. But you'll switch places. You'll stop because then it's your other person's. And once you're finished and you log roll in back, I'm done. Now, you get 12 minutes to do that. I just did it really slowly and it took me maybe 5.
9 minutes.
Okay, 9 minutes. I'm 3 minutes to the good. And that's moving slow and explaining.
Question, obviously we're not gonna have somebody, they're gonna give us vitals, because,
You have to ask for them. They'll give
okay,
you
where am I gonna ask for vitals at?
the person sitting behind the desk in
where
front of that
at in the
computer.
assessment?
What did I do when I did that before I moved to
Right
this
here and
side?
right here?
What did I do before I went over to this side?
Say that your partner.
I cleared this arm.
Okay, 4 vitals, okay, so you
So
want to
in
clear
case
an
help
arm.
came up, didn't you hear me say that?
Yes.
I've already cleared this arm in case my additional resources are here. I can get a set of vital signs.
So
for
at
that
the
arm.
test, clear the arm and then say, I need a set of vitals.
Well, then they'll get one if that's what you want. Then that's not the important information to know then.
Okay,
Okay?
yep,
Don't forget to transport your patient, high priority.
right.
What about your lung sounds?
Oh, shit, I forgot the auscultate lung sounds, yes. There you
You do
go.
the front and
Forgot,
back.
huh?
Front and back?
Front and back?
No,
No, just the front?
just the front.
Okay.
This is a rapid trauma assessment. I don't know where people are coming up, check this back shit. You don't do that in a rapid trauma assessment. All you're checking for is, are they there? Are they there?
Make sure
Because
it's
if
behind.
you know, are the uppers there or the lowers there? If not, I got like they said, you have no lung sounds on the left side. Could that be life-threatening?
Yeah.
Ah, so then I would further expose the chest to see if I find something like a sucking chest wound, any open wounds, something like that, something that I could fix. Or if it's a tension pneumothorax, that's a life-threatening. I'm gonna stop what I'm doing now, low roll them, put them on a backboard in the medic, and we're going to the hospital. I'll finish this in the back of the medic. But you gotta finish the assessment. You gotta let them know when you find something life-threatening, what you would do. Stop the assessment, fix it if I can. If it's a tension pneumothorax, can't do anything about that, right? Except recognize it and get them to the hospital. But that's treatment, isn't it?
Yes.
Yes.
Recognizing a life-threatening injury, knowing I can't do anything about that. I'm gonna put them on a backboard now, strap them down, we're going in the back of this medic, and we're getting out of here, going to the hospital now. On the way to the hospital, I would check. For stability, you have to finish the assessment. You get a lot of people that find this life-threatening, say it was a sucking chest wound, and then you only have to verbally fix it. I would put it with an open hand, tell my partner to go get me an occlusive dressing and some tape. I'd come down here, I'd tape it on 3 sides, leaving a flapper valve And that's what I would do to treat it, and then move on. You don't have to actually do that, because you're gonna do a random basic skill once you get this done.
Okay.
You and your partner are both doing,
Your partner is standing here like this.
okay. So they're
Holding
not,
C-spine.
okay.
Now, you think they have it easy, don't you? No, they don't, because they're relying on you to know what you're doing. You can help them if, like, they get here and all of a sudden, after the thoracic area, they get stuck. They don't, you would say, now we would palpate the medic. You can give them a little help, you just can't tell them what to do the rest of the way. But if you don't open your mouth, and you both are gonna fail. Or if they do something wrong and you see it, stop. That's not the way we would do that.
So it's
Because
okay
if you
to
don't
correct
stop
each
them, then
other.
the evaluator's gonna figure that, and you don't know what the hell you're doing too.
You're
And
just as guilty of neglect of the patient
and then
as
you
they
will
are.
both have to retest that. But, like say, I saw them not palpate the abdomen, because since I talked about that. I would say after he moved, sir, I would have palpated the abdomen. I'm telling him to palpate the abdomen, but he won't do it, but that's what I would have done. I can guarantee you, I would pass, he would fail, or she would fail.
Where do you wanna auscultate for lung sounds when you're?
Mid-clavicular and mid-axillary.
No, at what point, like when you're doing the chest?
First, I want to make sure I got equal chest rise and fall.
Okay,
And then you can listen for lung sounds, okay? Because you're
Alright.
checking for equal rise and fall. Now I want to hear, do I have lung sounds in the uppers? Do I have them in the lowers? Now I can take that off. I'm telling you, the best thing to do before you start the assessment, because all the equipment will be out, because I'm setting this thing up Friday afternoon at 2:30, I'll have this all set up. Best thing you do is take one of those pen lights and take your stethoscope before you even start the assessment, put it right there.
okay,
Because guess what?
you can't
You ain't
forget.
gonna forget, you ain't gonna forget to listen to lung sounds if that's right there, are you? That's what I would do. And then when I would get down to here, I'd put this on. Oh, I'm at the thoracic area, okay? All right, I'm checking for equal rise and fall. I'm checking mid-clavicular, mid-axillary for lung sounds. Now I can put this down. But I would walk over, I'd pick this up, I'd pick up the pen light, I'd put it right on top of the mannequin. That way you're not gonna forget, check this when you're up there, and you're not gonna forget to auscultate lung sounds.
So when we're checking
Just a little
for,
tip.
when we're checking for eyes, say if it was an unconscious trauma like you're doing, and they're like, the eyes are not pearl, they're pinpoint, are you going to continue with your assessment, or are you gonna assume there's?
Is pinpoint eyes, if they're breathing well enough to sustain life, or pinpoint pupils a life-threatening?
No. Okay.
Fine.
Nope, all right, gotcha.
If somebody could be high, still
Alright.
hurt, but he's breathing, you know, if he wasn't breathing, you know, they'd say we got here and they said, nah, his breathing's only 6. Well, now I gotta stop and bag him, because
Yeah.
he's not breathing well enough to sustain life.
All right,
But, you know, and look, none of this stuff is, there's no, they'll tell you, when you're auscultating lung sounds, you don't hear anything on the right side or the left side. When you're down here, all of a sudden you took your hands back and now a big puddle of blood's starting to appear. Uncontrolled bleeding, direct pressure, pressure bandage, tourniquet.
okay,
It's all verbal fix.
okay,
You may do, oh, he has got a fist-sized depressed skull fracture on the right side. When you did your decap BTLS, you found they have a fist-sized skull fracture on the right side. That's a pretty serious finding. That could be deadly. I'm going to stop. We're going to log roll him. We're going to put him on a backboard, strap him down. We're going to put him in the back of the medic, and we're heading to the hospital now. Now on the way to the hospital, I check my pupillary reaction, the phase bone. I recognize a life-threatening injury. Nothing I can do about it, except recognize it and start heading to a trauma center.
gotcha.
Okay? Sucking chest wound or something like that, I can temporarily fix that. Not fix it, but I can treat it temporarily. I would treat it, finish my assessment, and then go. Remember, you gotta transport your patient. If not, I'll be sitting there going, are you done? Yeah, I'm done. Okay, so you're gonna leave your patient, and we're not gonna say, what are you gonna do, leave your patient in the middle of the street? Transport your patient and do my reassessment every 5 minutes. You need to say that. If not, I'm assuming, okay, you're just gonna stay there then, I guess. And that's what I'd write up as an evaluator. Students did not transport patient to a hospital. And then I let Mark make that decision. whether he's gonna make you retest it or not. Probably not, that's kinda chicken shitty, but still. You need to transport your patient. The end of your medical assessment, now I'm gonna I've treated my patient, I'm gonna transport them, they're a high priority, I'm gonna reassess them every 5 minutes with vitals and start at my primary assessment and work my way back down again. You can say a lot of this verbal stuff, is verbal. It's hard to get used to, but that's what I tried to get you guys used to way back in Mod 1.